Welcome to Like Minded with Dr. Patrice. Each episode, we'll sit down with different types of experts and unpack the role of mental health in our day to day lives. In this episode, Dr. Shareefah Al'Uqdah joins us to break down the barriers, biases, and awareness gaps that too often define mental health care for communities of color. From the cultural stigma that keeps young adults from seeking help to the systemic gaps in insurance and access, this conversation dives deep into what it really means to offer care that affirms identity and honors lived experience. Dr. Shareefah is a licensed clinical psychologist, associate professor at Howard University, and founder of Your Neighborhood Clinic. As an associate professor at Howard University and a champion for mental wellness in the Black community, Dr. Shareefah brings over 20 years of experience helping individuals and families heal in ways that honor their identities. She secured more than $3 million in grant funding to support work that bridges research, policy, and practice by providing training to ensure the next generation of mental health providers are competent. Affectionately known as your neighborhood psychologist, Dr. Shareefah brings her whole authentic self into every space. Welcome, Dr. Shareefah.
Thank you so much for having me. I'm so happy to be here.
um, I wanted to talk about the beginning of your journey into mental health and where you saw that there was a real need that wasn't being met in the community. And I read that in 2008 there was a case that happened in Washington D.C. And could you tell us a little bit about that?
Yeah, so in 2008, I was actually in graduate school. I was at Howard
Mhm.
University and I actually lived in Southeast DC, Ward 8. And his, well, not historically, but in recent history of DC, Ward 8 and Ward 7, east of the river, is one of the more under resourced
Mm-hmm.
areas of Washington, DC. And so there was a woman by the name of Bonita Jacks who had four daughters and suffered a mental health crisis,
Mm-hmm.
experienced a psychotic episode, and eventually actually killed her children. But the sad part was that all of these children were of school age. All of these children were supposed to go to school and went missing from school for months while her mom suffered this mental health crisis. And it wasn't actually until they were evicting her out of her home that they discovered that she, in fact, had, killed her children. And so that really just highlighted for me the need for not just mental health services for individuals, the direct clients,
Yes.
but also to increase mental health understanding for the community, for individuals who may come in contact with children who may have parents
Mm-hmm.
dealing with severe mental health issues, but just for everyone who may have a neighbor, who may have someone that they are in their life with and they really don't know what is happening and what is going on and who and where they can reach out to. And so it really just cemented into me that um, psychology, mental health really needs to be among all of our
Yes.
neighborhoods.
Yes. No, I mean it's so true because with that situation, with that tragedy, there's so many places at which if things were in place that someone could have stepped in and realized the kids were not at school. Why are these school age children, why are they not there for months? How come no one's hearing from anyone? And if people feel like there are resources in the neighborhood, how much sooner they would reach out to someone, versus
Mhm.
kind of just, okay, well, hopefully it'll be fine, and hope it's not really that much of a strategy. So that situation and hearing that story, that changed what you felt like you needed to do in the community and with your work.
Yeah, it really drove home to me that I really wanted to do a community mental health
Mm.
agency that really reached out to the community, that interfaced with the community, that helped educate educators as well as just everyday people
Yes.
around what mental health is and around how they can access mental health resources.
Mm-hmm.
And I will say that with the Bonita Jacks case, a lot of teachers did call. A lot of teachers
Really?
did reach out. A lot of the girls teachers did call. They called social services,
Uh-huh.
and so it really did spark a lot of wraparound
Yes.
services within the DC community to ensure that because sometimes mental health can be a silo, right? Like,
Mm-hmm.
not everybody talks to everybody, and then
Yes.
there's a lot of confidentiality.
Yes.
And so it did sort of really push these wraparound services. It really pushed having services a lot more in home as well as school based
Mm-hmm.
mental health
Mm-hmm.
services for individuals. So it really did help transform and sort of illuminate where some of the cracks in mental health services are, at least in the Washington D.C.
Yeah,
area,
I
and
think
a lot of
that's
things.
pretty universal, not just in Washington D.C.,
Yeah,
right? Because you're what you're saying. It highlights that some individual people might have been worried, concerned doing their job, but if your job is then to make a report and the next person has to follow up on it, and they're not doing that, then you can see how situations like this happen. So the way that you're talking about it being in the community with everyone being a part of it and feeling like mental health is for them, not just the professionals,
yeah,
but everyone. It's so important, and yes, not unique to DC. Unfortunately, it's everywhere. We definitely see that a lot in Los
yeah.
Angeles as well. Yeah. Um, so we just wrapped up Minority Mental Health Awareness Month in July. But you say like these conversations have to happen year round. What's missing from the way that we approach the awareness part of it in your view?
I think a lot is missing. I think there's a lot. I think there's a lot of conversation around um, what mental health is,
Mm-hmm.
right? Like a lot of surface conversations about feeling good, about self
Self care.
care. Yeah. But it's not a lot of, well, where can I actually get help?
Yes.
How do I prepare myself if I am going to get professional therapy? Like, what are some of the preparational steps that I need to do? There's also not a lot of conversation around, how do I know I'm getting better, right?
Mm.
Like, how do I know that I'm getting better or even getting worse? Where it is time for me to go out and maybe step up the type of treatment and interventions that I'm using.
Yes. Yeah, I think that's something, whenever I see clients, and like not just new clients, but reminding clients that I have, it's not linear, right? When you're going to therapy, you might not feel good like the first two sessions. You might feel like, okay, I'm getting better, and then it can go back down, right? And it's not going to be a clear path. And so being able to talk about that and saying, I thought I was getting better, and now I'm not. Now I'm feeling worse because now I'm actually thinking about all these things that are coming to the forefront.
Mhm.
Maybe I've been trying to suppress for a while. What is that? How do I get through that period? How do I talk to my therapist or talk to other people in my life about what's going on with me? I think just having that language. And I laughed when you said self care, because it's the thing. People are like, I'm supposed to have self care and it's supposed to be like this and it's supposed to look like that. And I don't know if that's available to me, and maybe just dispelling, some of those ideas and some of those myths about what mental health looks like.
Yes, yes, I completely agree, and I talk a lot about, especially for Black people,
Mhm.
minority people.
Yeah.
Like, I feel like we have engaged in self care, throughout the beginning of time.
Hmm.
And so I really try to push away from the capitalization of self care.
Mm.
Like, it's talking to your grandmother.
Yeah.
It's painting your fingernails
Uh-huh.
when you just want to paint your fingernails.
Hmm.
Like, self care is anything that you do that reflects and makes you feel whole. It's calling out sick from work and using your sick days.
Yes. Yes.
Like, it doesn't have to involve the 4 star, the luxury, like, it
Yes.
is all of the simple ways that we enjoy and feel joy
Hmm.
and allow ourselves to um, be our whole self.
Yes.
That is the essence and the core of self care.
Well,
And
and I love when you say it like that, because that makes it feel much more accessible to people. Like, oh, I can do that. I can reach out to this person, or that does kind of fill me up. That does nurture me, and that's something that's available to me. And just giving people other ways to consider what self care can be. And maybe the ways you're already doing it are the ways that you can start doing it. That are different than what you might have imagined, because that is true. That capitalization of self care it's a barrier. It's another barrier, for a lot of people
mhm.
when they might already have enough barriers, and don't need to add any more. You were starting to talk about like in the Black community. Talk to me about the community that you serve.
Yeah, so I am located in Washington D.C. and my clients actually are fairly diverse. I
Mhm.
feel like I work with a lot of first timers,
Mhm.
people who are starting therapy for the first time. We do serve a lot of African American women, but a lot of women from various other ethnic backgrounds. I'm also African American Muslim, so I
Mhm.
also get a lot of Muslim American clients, international
Mhm.
immigrant Muslim clients as
Mm.
well. But then I also am located very close to Howard University. So I also get a lot of emerging adults,
Okay.
young adults, college students from not just Howard, but other university
Mhm.
campuses in the Washington, D.C. area. And so we really try to reach out to all walks of
Yes.
life. They call us the DMV within
Yeah.
the within the DMV
Mm.
area to sort of help them. We are hoping to expand our services to family to really start doing a lot more
Oh.
family therapy
Mm.
this upcoming year, just so we can really do, all of the things that's relevant, I think, for diverse communities. Like,
Yes.
it's not, I like to say strong families make strong individuals.
Mm.
And so I'm really trying to help increase and strengthen family bonds and family connection
Yes.
to improve mental health and mental wellness also.
Yeah. I really appreciate the reframing of that because I think sometimes people think, okay, well, if I get myself together, then I can heal everyone else around me. But the way that you describe that is like, let's start with the family, and then out of the family, the individuals could be stronger. I love that. I'm going to remember that and use that.
Mhm.
So I know that the community that you serve is diverse, but what are some kind of similarities you might see among different like minoritized communities or like first timers? What are some of the things that people tell you are their concerns about therapy?
Relationships.
Mm.
I will say that a lot of people, the overarching thing right now is people are trying to navigate relationships,
Mm.
whether that's getting into a relationship, getting out of a relationship, their relationship with their parent, their relationship with their boss. People are navigating relationships and all of the wonders that come with that. I
Yes.
will say that is like the overarching theme of clients coming in now.
When you have first timers, um, how do you kind of get them comfortable with the idea of going into therapy? I mean, I just think, at least in my experience, I've worked in community mental health here. Um, there's a lot of stigma about who therapy is for and who it's not for, about telling a stranger, all your deepest, darkest secrets, and that not being something that maybe a lot of us grew up doing. So, how do you talk to first timers about that?
I will say, my first timers are really like begging to come to therapy. Like, they will send an email like, is somebody able to take me tomorrow? I'm like, I'm like, who's available? Like, they are really like, somebody help because it's about to go left immediately. So I will say that they generally will come in a lot of times like out of a crisis or
Mm,
thinking they're on the verge of a
yeah.
crisis. And the difficulty that I have is them doing the work after they've gotten out of the crisis mode.
Oh,
It's
interesting.
like it's like almost, the analogy I give is if people go to the hospital when they are in sort of like a diabetic
Mhm,
emergency.
mhm.
But then to really treat and manage diabetes, you have to do the care
Yes,
after
yes.
your numbers, come down.
Mhm.
And my clients will be like, "Oh, I'm off the bridge. I'm okay now. We're done. Bye. See you when I see you." And it's like, no, the work is really just getting started. Like,
Yes.
we don't want you to be back on the bridge 2 weeks from
Yes,
now.
that's right.
Um, so that's really what I have to like work on is like helping them to understand like we're gonna get you through this crisis, but we need you to stay at
Mhm.
least another 2 months
Yeah.
to really make sure that you're not gonna be in crisis
Mhm.
mode 6 months from
Yes.
now. And so that's what we sort of have to educate them around and help them to understand.
Yeah, absolutely. I know I do think that sometimes I don't know whether it's like different portrayals of therapy or like mental health like crises that you see and you're like, okay, this was this one period in my life. And a lot of the work is like, but what led to that? Like, how come there was no noticing of the triggers along the way before it got to this point? You need tools, so that next time if something does happen, because life is going to life, right? Something will happen. Then how do you have the tools to be able to notice that is happening with you and to be able to like look after yourself or get the care you need before it gets all the way up, to that level again. So I think, yeah, it is kind of interesting. Like, I love that they're like, I need to see someone now. They recognize they need to see someone. And it's like, and then what? What's the rest of the work?
Mhm.
So you were talking about a lot of the people, are like emerging adults. And so I want to talk to you about young adults, like especially those ages like 18 to 30. How do you see that this group experiences mental health differently? When it comes to all of the issues, affordability, stigma, and access. Because of course some of them might still be under their parents' insurance. What do you see in that in the young adult community?
I definitely, the affordability and the accessibility is definitely an issue. I encourage all parents, like that's some of the back to college
Mm,
mental health toolkits.
yeah.
Make sure your child has their insurance card. Make sure you know if their insurance is accepted out of state.
Hmm.
Make sure that you let them know, like you educate them about their insurance.
Hmm.
And um, if they don't have out of state insurance and they're going out of state for school, definitely pay for the university insurance and have them understand what that allows for them, because a lot of university insurance allows for them to see providers outside of campus.
Hmm.
And so you really want to walk through with them how they can understand their insurance, if they are on your insurance or if they have university based insurance as well. That just is sort of like an adult
Yeah.
conversation, in the same way that you sort of give them sex education
Uh-huh.
conversations. You want to give them those insurance education
Mm,
conversations too, so they can be empowered to make decisions around their own physical health and mental health.
yeah.
You know,
Yeah.
um,
That's such a good tip because I think that it's one of those things people probably skip over, maybe like the sex conversations because it might be uncomfortable. Do you see that parents and, young people don't really want to have that conversation or talk about, why there might be the need for, counseling or that kind of thing?
I see some parents are, I will say are very versed at it.
Mm.
They'll send me an email, especially if the child may have had a mental health crisis their
Mhm.
senior year, right? With
Uh-huh.
all of the stress of senior year of
Yes.
high school. Those parents are very versed. They're like, we're looking for providers. We want to connect them before they come.
Mhm.
I see you're close to Howard. Do you have available? I know you can't talk to me, so I've CC'd them on this email. Those parents are very versed. It's the parents where your child was doing really well. They
Uh,
may have been exceptional.
uh-huh.
They go away to college and then they have sort of an adjustment issue. And those parents are, oh my God, what do we do?
Panicked.
Those parents are a little like, I don't know, I didn't, and their children too may, they don't know what's going
Yeah.
on. They haven't experienced any issues with mental health. And so those parents are sort of the ones where we need to think about it, because everybody is like, my child is fine. Every child is
Well, that's what
fine.
we all want to believe, right? Like, it's not our kids.
Yeah,
That's for other kids.
yeah. But everybody's fine until they're not fine. And so you have to tell them, if you're not fine,
Yeah.
if something does happen, if these are the numbers that you can call.
Yes.
This would be the first step.
Mhm.
And so you do just have to give them that conversation of what if, just in case.
Yes. Yes. And I think that, part of that conversation with the parents often is like, this is not like anything bad necessarily that you've done as a parent. It's just life. Sometimes this happens. There's a lot of unique stresses associated, especially with going away to school, that you're leaving home, everything that you've known. And, I think also when you're talking about the kids who've always been doing really well, and maybe you go someplace else and like there's people who are, doing better in school than you or better adjusted, than you are. And that can also make people kind of, check and be like, well, who am I? Like, well, I thought my identity was this and now I don't know who I am. And so just normalizing that conversation and that period of adjustment, doesn't mean you were a bad parent, doesn't mean that, your kid's not going to get out of this period that they're in right now, but right now they need help, and so I think sometimes
Yeah.
they just need to know that we're not judging you as a parent. It's just this is where
It,
we are.
we're not. And I just want to add a caveat to
Yeah.
people who don't go away to school,
Mhm.
right? Because that can be stressful too. Your
Oh, so
friends have
true.
left, you haven't left.
Yeah.
You thought you were going to have this job, it hasn't panned out.
Mhm.
Those, and they're 18, 18, 19, that's an intense time,
Yes.
and so those parents too want to educate their child.
Mm.
They're still at home. They feel like they're an adult.
Yeah.
They graduated high school and
Mhm.
they're like, well, what next? What now?
Yes.
So even if they haven't gone
Mhm.
away to college, that 18 to 25, honestly, time frame is a very intense development. It is almost equal to 12
Yes.
to 18. It's
Yes.
a lot going on 18 to 25.
Yeah. No, thank you for saying that. Thank you for adding that because it is really important. It's an adjustment no matter what your individual situation is. And also that I am an adult, but if I'm living at home or if I'm in the school, like there's all these ways in which you're not being treated as an adult or you're not ready to be an adult and to make adult
Mhm.
decisions. So yeah, I really appreciate you saying that because it is true. It is always going to be a period of potential challenge, adventure, a lot of unknowns happening there. Um, so I have a question for you about young adults of color, specifically who might be struggling to find a therapist. When you see people, do you often have people come in and saying, like, I know that your practice has therapists who might have a similar background to me, and that was important. Like, what kind of issues do you see young people saying that they need to have in a therapist to kind of have a good fit with them?
They definitely are looking for someone who they feel matches
Mm,
them ethnically, racially, gender,
mm,
and also
yeah.
orientation. Right? 18 to 25 is also a time where people are experiencing themselves
Hmm.
as their sexual self,
Yeah.
right? It's a big sexual immersion
Hmm.
phase as well. And so they may be looking for people who may match them around those various identities, but they're also looking for someone that they believe is not judgmental.
Yes,
So that's
yes.
a big thing. They want to be like, I
So
don't want
true.
to be judged. I want somebody that gets me and that's not
Yes.
judgmental. And so they are definitely looking for that as well,
Yes.
in terms of therapists.
Yes. It's funny. I've definitely had like, especially like young women come to me and say, like, I just didn't want to see another like old man therapist. I felt like I was talking to my dad and he was like kind of like patronizing. I've had several clients say that kind of thing. And I'm sure that's not always the case, right? But it's how it feels for you when you sit down there. Like,
Mhm.
well, are you going to share fewer things if you feel like this person reminds you of someone who might judge you or who may not,
Mhm.
be able to listen to what you say and be open to your experiences. So I do think that is it's just not something that I think we always think about, but it really matters in how people experience therapy because if they're not comfortable with you, they're not going to be able to be their full selves in the room with you.
Yeah.
Yeah.
And I will say
Hmm.
a good therapist should make you think they are all of those things. At
Mm,
times they should remind you of your
yes.
father. At times they should remind you of the
Interesting.
friend you hate, the friend you love, your mom, like and because all of those different
Mm,
relationships have to be worked through. You know what I mean? Like
yeah.
if you experience me, let's say as a father that abandoned you, and
Hmm.
you're like, you didn't call me, you didn't email me back. I send you emails and
Uh-huh.
you slow to email. You know what I mean? That's something that we're gonna talk about. That's
Yes.
something that we need to talk
Yes.
about. That's something that we need to explore. But what we have to learn as therapists
Hmm.
is to be able to talk to them. Like, I
Yes.
wonder how this made you feel. I
Yes.
wonder if me not, like, I noticed you sent me an email and then you followed up,
Yeah.
like, what was going on with that? Like,
5 minutes later.
we have to, yeah, like, the email worked. I got it. Like, but I wonder what was going on with that, because the
Yes.
client wants to work through it,
Yes.
and sometimes they will be like that anxiety of
Mhm.
that tension. But that's really why you need to work through feeling
Yes.
like somebody is your dad and
Yes.
they abandon you, or they judge you, or they don't hear you.
Mhm.
Not at the outset, because that's sort of deeper work,
Yeah.
but eventually your therapist should make you feel
Mhm.
all of those
Yes.
things, and then you trust them enough to discuss it and work through it.
Yes, absolutely. I mean, it's so important, right? That you're noticing how the client is, reacting in a certain situation. And when you have that trust, being able to call it out, in a caring way, but in a way that you can talk about it. Like, you noticed something and now we need to discuss it, because that's, I think, probably a lot of the repair for people, because it's not the first time they exhibited that kind of behavior, but maybe it's the first time that someone talked to them about it in a way like, curious, let's explore. What does this mean? Where do you think this comes from? How would you like it to be? Because, I think I love that you said that it's okay for the clients to feel those feelings. But then it's like, now what? What's the work?
And I will say, now our young adult clients, and I will even push back to the teenagers.
Hmm.
Our teenage clients, them 16-year-olds, they're gonna feel it and say it.
Oh, tell me
You
what you see
are
with the 16-year-olds.
Oh, they're gonna be like, you acting just like my mom. And will, like, you sound like, they'll be like, you sounded like my mom now, and they'll say it and will be fully immersed and
Mm.
angry and
Yeah.
upset, and will not come to therapy for 2 weeks.
Mm.
And then you're like, can we talk about you being upset and what that means, and how that might actually play out with your actual mom?
Yes. Yes.
Because they will do it, and they will be like, and you
Mm.
and you have to sit with it and massage it as the therapist, because you're not being their mom, but what you are being is maybe the voice of dissension,
Mm.
or the voice of disagreement. But that's a skill that people have to learn. How can you have relationships with people and you're not going to agree all the time?
Yes. Yes.
And you still feel like, well, this person actually cares about me and empathizes and
Hmm.
understands, and maybe also disagrees.
Yes. And being able to hold both of those things. Because I'm sure you see this too, like, especially, in couples, it comes up quite a bit where the desires that if you know me and you care about me, you should be able to know what my needs are. It's like, well, okay, you're setting yourself up for disappointment, because I can understand that desire for someone to know you so well that they will, anything that you can just have a look and they're gonna be able to meet that need. But like, let's be realistic, and like, how do we learn how to ask for what we need, and give that person a chance to actually fulfill that need? Like, how do we go into relationships knowing that we are different people, and so there will be disagreements? That doesn't mean that there needs to be um, challenges to the relationship. Doesn't mean the relationship needs to end. Doesn't mean that there needs to be anger in the relationship. But there will be differences and there will be disagreements. And like, how do we learn to address those and expect them?
And sometimes I won't be able to fulfill your needs.
Sometimes I can't
That
do it.
I cannot.
As a therapist or the
I
partner
like,
or any, yes.
especially as a therapist, but
Hmm.
especially as the
Yeah.
partner. I like, I cannot take care of your need right now,
Hmm.
or maybe even for the next month, given that we have two children
Yep.
under 3 years
Yes.
old in the house, given that, you know what I mean? Like,
Absolutely.
and how do I then manage my needs not being met in this
Mm.
marriage and not tearing down the marriage?
Yes.
Like,
Absolutely.
it gets
100%.
complicated real quick.
Yeah. Okay, so this is something I'm curious about, what you just said, because this is something I talk to clients about sometimes. Um, is, sometimes the need can't be met right now. Sometimes what you're asking this person to do is not possible, right? If we're talking about like a parent wound, this person cannot go back and do all the things for you that your parents should have done, your caregiver should have done for you. So how do you think about reparenting yourself? How do you think about getting those needs met for yourself? And then so that you can have a healthy relationship. How do you talk to clients? I mean, you said you're doing a lot of family work. How do you talk to families
Mhm.
and, to partners about that?
So I definitely like to integrate narrative
Mhm.
therapy in my work
Mhm.
because I think all of us have to rewrite our stories.
Yes.
All of us have to go back. And the analogy that I'm using is to see ourselves as a mosaic.
Mm.
I think we so often just see the brokenness. And it is for us to take all of that brokenness and to see how it is really a work of art
Mm.
and to really see how the broken pieces of love that my mother may have offered, that my father may have offered, I have gathered up
Mm.
and I have had the brilliant ability to create this work of art that is me and to really just see ourselves as that beautiful mosaic work of art that is a collection of all of these other broken pieces that people have given, and to know that that is beautiful. Like it is so beautiful and talented. And
Mm.
I just think that that's the work. That's what I try to do with my clients, is to reframe how they see themselves,
Yes.
because that's it. My mother was broken, her mama was broken. But in their brokenness, they was whole and they was beautiful and they was genius.
Yes.
You know? And we have to see that as that.
Mm.
And we have to then see ourselves as that.
Yeah.
And to know that it's still a million pieces of broken glass out there for us to still go get.
Yes. Yes. Yes, that's so beautifully said, because I think that we can get stuck in that place of like, this happened to me because of, there I'm dealing with life now because of what's happened to me, and I can't change what's happened to me. So where can I go from there? And the way that you just described, accepting that there has been brokenness and that there has been pain, and all the ways in which we have power to pull ourselves together and know that we will have to go through it again, at some point, and we can do that. We can do this work again and again, and getting stronger each time. It's really a beautiful way to look at it, and some gives us like some agency, back
Mm-hmm.
into the situation as well. Mm. Yeah. So I'm curious your thoughts about the way that mental health is discussed in like kind of in pop culture, like out in the zeitgeist. I feel like in so many ways, I love, and I've talked to guests about this before. I love that we talk about this and we have this language. I worry that, there's overuse or like misuse of terms, and you're diagnosing everyone that, you walk by on the street and that kind of thing. But when you're talking to people, in your practice about maybe some things that they're like, oh, I see this person, they're gaslighting me, or they're love bombing me, or that kind of thing. How do you talk to people about that?
Well, I'm a very curious questioner. So I'm like, tell me, I give them the tell me more. Help me see it the way you see it, because
Yes.
I actually want to make sure that I am clear
Mm.
about their experience,
Yes.
because a lot of it is interpreted, but I don't actually understand the actual actions. What
Mm.
are the actual behaviors? What are the things that you saw? So I really have to help them tell me the full sequence of
Yes.
events, so then I can understand the interpretation, or how they experience that experience. So
Mm-hmm.
that's one thing that
Yes.
I definitely encourage clients to do, is to really get comfortable telling a full story
Mm.
and not just the interpretation of the events that happen,
Okay. Yes.
because that helps the therapist understand the complete
Mm-hmm.
picture of the scenario,
Yes.
right? So that's one thing. But then two, I always tell my clients that in therapy you're going to get a PhD of you. You're not going to get a PhD in the other actors in your life.
Yes.
So I always remind them that, oh, it's great that we know he's a love bomber, but help me understand what were your thoughts and feelings
Mm.
during this action.
Yes. Yes.
When he said he loved you, how did that make you feel?
Mm-hmm.
What about that was significant? What about that helped you to want to stay with him or
Mm-hmm.
go with him? Because some people hear a person say they love them and run away.
Yes.
Like some
Absolutely. It's
people
scary to some
respond
people.
differently.
Mm-hmm.
Yeah. So help me to understand what about that caused your reaction, your response,
Mm-hmm.
had your thoughts and feelings. And that really gets the client to sort of, they're like, well, I don't know. Well, everybody would don't. If somebody told you you loved them, wouldn't you? And it becomes that because
Yes.
they feel like I'm questioning them, but I'm not. I'm really trying to get them to understand and gain awareness of their internal process.
Yes.
Um, and so I have to always remind the client, like, that's what we're here for. We're here to get a PhD in what was going on inside of you,
Yes.
not this love bomber, not this gun. You
It's
know?
it's funny because I feel like it's what separates the conversations that you will have with your clients that I have with my clients from a conversation they're having with one of their friends. With your friends, you can say he did this, I can't believe that she said this to me. That's fine, but like in therapy, you can tell us about that, but we need to know about your experience, to your point. We I can't just hear a story we haven't learned anything. We're going to be right back here, in a few months if you're just telling the story. It's like about the digging deeper and uncovering what it means a little bit more that happens in therapy. And I think that sometimes, I've had to stop clients that are like, oh, okay, yeah, this is the story. This is important. Like now what? Or like slowing it down where you're not getting, 45 minutes of a story and 5 minutes of interpretation at the end of the session. But
Mhm,
just, yeah, being
mhm.
able to have them like learn a little bit more about themselves along the way. Um, and I think also suppress that desire to diagnose everyone that you know.
Yeah, yeah.
Right, because then it really keeps the challenges outside of them rather than thinking about what it means to each person individually. So
Mhm.
Dr. Shareefah, so you're known as your neighborhood psychologist. How do you use that identity? And you've given us some examples of how you connect with the clients that you see. But how else do you use that identity to make therapy feel more community centered and culturally safe to your clients?
Yeah, I think a good example is, we just went back. Classes just started, I think, 2 weeks ago. So
Hmm.
yesterday was like my second class. And I was talking to the class and they were talking about
Hmm.
confidentiality. And one of the students was like, well, what if they told you, they committed homicide? Do you break confidentiality? And I was like, no. And they were like, but can you leave them? Do you have to work with them? And
Interesting.
I was like, but you don't think people who may have committed homicide need therapy?
They definitely need therapy.
You're gonna get rid of those clients. Those are the clients you gonna say nope, get out of my office. And so I really try to your question. I try to make my clients feel safe,
Mm,
bringing all of their self into the
yes.
therapy.
Yes.
So I'm your neighborhood psychologist. So if it's some hood stuff going on that you like, oh, this is unacceptable.
Yeah.
I can't tell people that I'm thinking or feeling this
Yes.
way. No, it's safe. Bring it on
Yeah.
here. Like I have worked with clients across the spectrum in various fields, clients who have been involved in child and family
Mhm.
services,
Mhm.
clients who have been found not guilty by reason of insanity, clients who have been in jail for various activities. Uh, all of your pieces of yourself, all of your mosaic is
Yes.
is welcome
Yes. Yes.
in therapy
I,
because I'm not going to say who hasn't thought of that, but a lot of people have had
Yeah.
various thoughts and various feelings and have engaged in various actions that they may regret or they think they shouldn't have done. And
Mm.
everybody is deserving of wellness. Everybody is deserving of therapy services that allows them to better improve themselves.
Yes.
And so that's really what I try to do.
Yeah, I love that. I think it's so true. I used to work in at the Department of Mental Health, and I led a group for women who were reentering after being in prison. And a lot of people are like, "Oh, is that safe?" I'm like, "It's so safe. They don't want to go back. They're not. They're. I'm not. I don't feel like I'm in any danger at all." And to your point, they need to talk to someone because a lot of the things that got them in the situation where they were was not having access to talk to anyone, going through
Mhm.
incredible traumas and feeling like they had to do it alone. And we're just not built to do that. It's not sustainable. And so I felt like it was needed in there more than many other places that they need to
Mhm.
feel safe and not alone and be able to talk to someone. And sometimes the work was like, okay, you're gonna have that feeling that's gonna come up. Like, what are we gonna do? I know you don't want to go back, so okay, let's work on not stabbing anyone today. And that's the work, you
Mhm.
know, and it's okay. But I think that is probably something that when you are new to this field. It can sound probably pretty scary, for you to say, nope, we're not going to report that person. And yeah, maybe we're even going to keep working with them and, because they might really need that. What are the other ways in which you train like new clinicians to be able to handle all the different kinds of things that might come up for them, as they're working with different clients or when they're feeling out of their depth, maybe when situations come up that they don't know how to deal with? What's the work you do with the clinicians
Yeah, I
and your
always
students and your
tell I
students?
always I always tell our students, one, go to therapy.
Mm-hmm.
I tell
Yes.
them go to therapy so you figure out how much your clients lie to you and withhold. I said, go so you realize how much you keep it to yourself and how
Yes.
much you changing that story so you sound okay. But then I also tell them that getting your doctorate is not equal to healing whatever experiences you want to heal,
Mm.
and so you want to always be in a process of healing and know that there is nothing vicarious or parallel to that you
Mm.
do have to do your own healing
Yes.
work directly and intentionally,
Mm-hmm.
because when you are in that room, your trauma, your bias, you want to suspend as much as you can,
Mm-hmm.
as much as you can, so the client can take up as much space as they can.
Yes.
Um, and and then I ask them to get clear on what they think about positivity and about wellness.
Oh, interesting. Say more.
I say when you believe clearly that all roads lead to wellness,
Mm.
it frees you up
Mm.
from
Mm.
being overwhelmed by clients being so anxious that there's no hope for them, or that you
Mm.
have to do so much, like it frees your anxiety up about your capabilities or lack thereof to really say, my client is going to get well. I can help them now, and if they leave therapy, I know that they're still going to get better.
Mm-hmm.
They
Mm-hmm.
might relapse, but they're going to come back maybe to me or to some other provider, and they're going to get better. And that you have to center yourself on that. And so
Mm-hmm.
I really challenge my students to make sense of that now, because if they don't, they're going to get burnt out.
Yes.
They're going to put that cape on and burn themselves out, and they're going to think that they have to do everything and be everything for
Yes.
everybody, and that's just not sustainable.
Yes, I think that's so important, and people probably don't realize, and especially like as you're learning, because you think, okay, I'm gonna go and heal the world, and it's like, well, people, you're helping people heal themselves in so many ways,
Mhm.
and so it's not all on you to see this person through. Sometimes you're planting a seed, and you may never see what happens in the end, but each experience you have with them is hopefully letting them know there are safe spaces. You have the tools. You can have. There's ways that you can empower yourself and you can heal, and you might not see that happen. I think it's so important. It's really hard to grasp when you're kind of in the beginning of it and you just feel so much pressure. But to your point, it's not sustainable, and it's not it's like a what quality of life for you. Like if I am resentful of all the clients that I have because it's taking up all of my time and that's all I'm thinking about, that's all I'm doing, I'm not showing up in the room for them. I'm not going to be able to be present with them when I'm sitting with them. So that taking care of yourself, back to that, full circle, self-care in all the ways that we need it. Like that's you're helping everyone around you, if you're able to do that, to take a step back. So I so appreciate the training, that you're giving to your students, and answering those questions and letting them figure out, how do I want to show up in the room, but not just in the room as a therapist, in my life, like with all my other relationships that really matter to me too. So I think that's really valuable advice. So Dr. Shareefah, if people want to find out more about what your neighborhood psychologist and what you're working on, where can they find you?
So I have a personal professional webpage, drshareefah.com.
Mm-hmm.
And then I also have my therapy site,
Mm-hmm.
yourneighborhoodclinic.org.
Mm-hmm.
Either of those link you back to me, email me,
Wonderful.
and you can definitely find me at either of those. So drshareefah.com
Mm-hmm.
or yourneighborhoodclinic.org.
Wonderful. Thank you so much. This has been such a great conversation. All of the work that you're doing and just the way that you address the gaps that are there in the community and train a new generation of people to do the same. I just think it's so important, and it's really really beautiful work. So thank you.
Well, thank you, and thank you for having me, and thank you for this platform to uplift mental health and mental health therapists. Thank you so much for all that you're doing as well.
Thank you. Take care.